Hi, I'm Jordan Grace Miller, and I'm a Senior Director at Inspire Medical Systems. The session I'm really excited about focusing on at South by Southwest is all about increasing patients' access to care through traditional marketing in a med tech, med device space. We've seen a ton of this in the last decade or so, but we've certainly got a lot of catching up to do when we start to think and compare ourselves to some of the more CPG or consumer product goods categories, the McDonald's, the Apples, the Procter and Gamble's of the world. Really take a simplistic, very direct to consumer approach, and the med tech space could really benefit from that. Patients have taken a very front row seat in the way they go about making their healthcare decisions. While physicians continue to be and will always be an important factor in patients' decisions in their healthcare, patients are starting to pick up a lot of the weight on their own when it comes to doing research and picking what specific treatments they want. Patients are following a buyer consumer pathway just like they would for any consumer good in the healthcare space where they hadn't in the past. So it's important that med tech, med device, and healthcare, even hospital systems, start to think about patients as people, approaching them as if they are someone to get to know, to interact with, and build a relationship with, to focus on exactly how they make their healthcare decisions and support them along that journey. And to remember that just because we work in a regulated environment doesn't mean we can't try new and innovative and direct ways to talk to our consumers. In this session, I want to highlight exactly how we can think about patients as people, how we can approach marketing, and some of the most proven and well understood marketing techniques, even in a space that hasn't had as much opportunity for it, and how we can view regulation as a sandbox versus an obstacle. What's beautiful about the regulatory environment that most of us work in the healthcare space is that for the most part, it's pretty clear. We know the boundaries, we know what we can do, what we can't do. And instead of building ourselves a fence, we build ourselves a sandbox to have a little fun and to innovate in. We can do really great things for patients if we give them access to information they hadn't had before, make really hard and complex problems simple for them so they can make a choice that's right for them rather than just what their physician sees about them. They know more about their compliance, who they are, what's going to work for their life than our physicians ever will. And empowering them, teaching them, and educating them, and supporting them on their healthcare decision journey will not only mean patients are living happier, healthier lives, but it also means there's more patients that we can treat, which helps both the entire population of folks with a disease state as well as our bottom lines.